Hi everybody, this is E Fresilli with Holistic Health and Fitness. I hope everybody's doing well today. So today I wanted to talk a little bit about thoracic outlet syndrome. There's my Carol Merrill for you. And what I'm going to do is I'm going to be general. I'm not going to get into huge bits about this, but I think it's important that you start understanding how critical alignment is and posture is and good biomechanics. So good biomechanics is you're moving properly with good posture, whether you're working out or just things that you're doing at home or whatever you do in your life, sitting at your desk, etc. So if you're not in good alignment, i.e. you're not in good posture, you're causing compressive forces, you're causing restrictions, etc., where the muscles, the skeleton, the nervous system is going to conform to that posture. So a lot of times we're slumped over, we're sitting at desks over a computer, it causes a forward head posture, what we call, or Janda called a upper cross syndrome, where you get these rounded shoulders and the back starts to round, and there's issues that go on with your lower cross syndrome also. And part of that, what I want to talk about again, is thoracic outlet syndrome. And we're going to break it down to three minor syndromes that fall into that. So the first one is Scalene's Anticus, and then costoclavicular syndrome, and then hyperabduction. And abduction is when, in this case, we're talking about the arms, when the arms are moving out away from the body. This is AB, abduction. When they move towards the body, adduction. So we're talking about abduction. And each one of these different syndromes is part of, or what can happen in a thoracic outlet syndrome. And what commonly happens is, whichever that syndrome is, you can get pain and numbness through the neck, whether either side of the neck, and then possibly through the shoulder and even down in through the arms. And it's caused by a compression, think of a squeezing, right, or a restriction of what we call the subclavian. So think of submarine underneath, subclavian, and clavian is clavicle. So the subclavian artery, vein, and what we call the brachial complex. So the brachial complex is a set of nerves that come out through the neck, through the spinal column, right, through your cervical spine. They come out, and they come in between two sets of neck muscles called the scalenes. And there's an anterior, think front, anterior, and the medial, and a posterior. So the first two, the anterior and the medial, they run side by side. So hopefully you can see this well. So this very front muscle right here, we're calling the anterior scalene, so the front scalene, and then right in between, right here, is the medial scalene, and then behind it, the posterior scalene. Now, I'm not a good artist, so you'll have to bear with my drawing, but it's pretty close, okay? You'll get the gist of what's going on. So here's your sternum right here, and up here it really is your manubrium, the very top, and that's where your collarbone, your clavicle, right here, attaches. And then it also comes into what is called the acromion right here, where it attaches through ligaments, etc. So you have the anterior, the first one, and the medial scalene that are side by side. And you'll see this blue right here, and that's what I'm using as the nerves, the brachial complex that's coming out from the vertebrae in your neck. They come out through each vertebrae in between. And they come through the muscle tissue between, this will be anterior and this will be medial, they come out through those muscles. So you can see that they're in between the front, the anterior, and the medial, the middle, okay? And then as they come through that, then they come in and they join with, you'll see the red, so that red is, we're designating as the subclavian artery, and the green underneath it, we're classifying or showing as the subclavian vein. So the vein, the blood returns, it returns up and in, and the artery is blood, fresh blood coming out of the heart and down to feed the arm, etc. And then you'll see the nerve bundle, that brachial complex of the nerves, they come in and they kind of wrap around a little bit over the subclavian artery, and then they kind of just run side by side and they come down. They come underneath these three muscles, which are your pectoralis minor, your pec minor muscles, and they attach to ribs 3, 4, and 5. So here's rib 1 right here. Here's rib 2. Here's 3, 4, and 5, and obviously you have 6, 7, 8, 9, all the way down to your false ribs, 11 and 12. But So these first three, 4, and 5, these ribs come out, and they come all the way out and around, and they attach to your spine, okay? But the muscles, your pec minor, attach to rib 3, 4, and 5, and they come up and join onto this bony process called the coracoid process, right here, and they attach there. So you'll see that the subclavian artery and vein and the brachial complex, that nerve bundle, runs down and it runs underneath the clavicle. So it runs here. I'm going to say that this is my clavicle, my collarbone. Here's my sternum. It's attaching right here. And it's wrapping around. It's tying into my shoulder here. So there's the clavicle. And underneath it is your first rib, which here's my clavicle. And right underneath it is my first rib. So that complex, these subclavian artery and vein, comes up and over the first rib. So it's coming underneath, it's coming up and over the first rib and underneath the clavicle. Does that make sense? So that's what I'm trying to show here. It's coming up, it's under the sternum, and then it comes up, it's underneath the clavicle, subclavian, but over the first rib. It falls, it comes like this, up and over the first rib, and then the clavicle is over on top of it, okay? And then it runs down underneath the pec minor, the 3 pec minor muscles, which are right here. So it runs underneath here. And then it runs down your arm. And then it branches off. The brachial complex starts breaking off actually up here. It comes down. All 3 of them are separate. And then it runs down your arm. And you have 3 branches, basically, if you think about it that way. It runs down your arm to your radial nerve. Think about your radial pulse, this thumb side of your hand. The medial nerve, which comes right down the middle, medial, and the ulna. So you have a radial and an ulnar bone that comes down your arm, and it feeds your arm, your hands, etc., and all the muscles down through there. So that brachial complex runs down your arm, 3 of them, okay? And then the artery, the subclavian artery, comes down and runs down, and of course, it's joined also with the subclavian vein, which returns the blood flow back up and in. So that's the complex. So that triangle right up in here is what we're looking at, where all this compression and also right here happens. So to give you an idea, the scalenus anticus syndrome is when the scalenes, the anterior, the front scalene, and the medial scalene squeeze basically, not basically, they're compressing together, and it's pinching either the nerves, the brachial plexus, and even possibly the subclavian artery and subclavian vein. So if there's any compression of either the nerve itself, the artery, or the vein, you can imagine that that's going to either restrict the neurological information that's driving down, right? Think of a nerve, it gets numb in a sense. So people can get numbness and or pain here, through their arm, down through their shoulder, etc. Or blood flow can be restricted, because it's just like either way, whether it's the vein, the artery, or the nerve bundle that's running down, it's just like a water hose, a garden hose. If you squeeze it, not enough gets through, whether it's a signal, a nerve signal, or the blood, the artery going down or coming back. So that causes dysfunction. It causes numbness, pain, etc. And it can cause a lot of what we call syndrome issues. So what happens here is with the scalenus anticus syndrome, these muscles, anterior and medial scalenes, are actually squeezing or compressing the nerve bundle and or down lower, you can get the artery and the vein, the subclavian vein. So either way, what we need to do is recondition, or whether it may be stretching or creating better biomechanics, better head position, etc., so that there's not that pinching going on. Okay, and that can be caused by a whole bunch of challenges posturally. Breathing improperly can cause this, because the 2 front scalene muscles are a very big component of what we call auxiliary breathing muscles. They help lift that first rib when you inhale, that lifting of the chest. But if they're being overworked and you're mostly breathing what we call chest breathers, then you're using these muscles to pull too much, and they're getting tonic and hypertrophy. They're building too much, and that can cause a restriction and a compression on that. So we need to make sure those are stretched correctly. That's part of it. And the head position is correct, and we have good biomechanics, and our breathing is correct, and there's a whole bunch of things that we need to look at. That's the general part of this. I can't go into all of it right now. But the next one is costeroclavicular. So what's happening is that the clavicle is somehow compressing on, it is being pulled up into. So there's a compression from the clavicle compressing that artery, vein, and or the brachial complex that runs down. So it's being pressed down by the collarbone. Again, what we call a dropped front panel, or there could be biomechanical issues going on with the joint here up in your shoulder from the clavicle, because the clavicle attaches here and it attaches up here. So there could be issues there causing restrictions. Again, that first rib with breathing, if it's being pulled up too much, you're going to get that kind of compression also. And then hyperabduction. So abduction, again, we talked about the arm coming up. So this has a lot to do right here with the pec minor, these 3 pec minor muscles, ribs 3, 4, and 5, where it comes up and it attaches to the coracoid process. So if you imagine your arm in this position, there's not a lot of tension on the pec minor muscle because it's neutral. But as I start raising my arm, I can actually feel that muscle is getting stretched and it's pulling. So if the pec minor is tight or if there's other dysfunctions happening, that's actually pulling on this. And what you're doing is see how the vein, the artery, and the brachial complex, that nerve bundle, runs down and underneath, and then it comes up and out. So you're going to get, as that arm comes up, you're going to get compression on that as it passes underneath here. All right? So with that compression, again, is going to, just like that watering hose, that garden hose, it's going to squish it. It's going to compress it, and then you're not going to get an open channel or an open signal through that nerve, those nerves, the 3 as it branches out, radial, medial, and ulna, right? So you're going to have issues there. You could have issues with blood flow because you're pushing it down, so you're restricting the blood flow either down and or up, and it's probably going to be both. And usually it's a combination of all 3 of them. It's usually not one or just the other. You're probably going to get all 3 to some degree. Okay? So what happens is as the arm comes up, that's when that's really happening. So what we'll do a lot of times to test that, one test, there's many, is to hold your pulse, find your pulse down here. It feels pretty good. Everything's flowing fairly well. And as we lift your arm up, we're looking to see if there's a drop in the amount of consistent blood flow to your arm. So if it gets weaker, it's not as strong, your pulse isn't as strong up here as it would be down here, then we know that there's some compression going on here, and we're looking for other things that are causing that also. So that's just an overview of the 3 main things that can happen with thoracic outlet syndrome. And again, a majority of what's happening here, no matter what kind of pain or issues you're having with your body, especially if it's coming from something that we'll consider to be biomechanical, you're moving, or postural, that's where we want to start and look at what's their posture like? How are they using their body, the biomechanics? So when you're doing, and we see this a lot, guys in a gym doing shoulder raises, shrugs, chest presses behind the neck, then there's many other things other exercises that do this also. But if you're not in good posture, then you're causing this dropped front panel or this rounding of the shoulders, the pronation of the shoulders, and all this that can tighten those pec minors because the pec minor will pull those shoulders in. So we don't want that to be happening. We need good posture so that we have, in a sense, we're talking about here, good blood flow back and forth, and a good pathway, open pathway for that nerve channel to be working correctly, to get those signals going up and down, and there's no numbness, no pinching, etc. So again, there's a whole protocol that we move through when we're looking at, is this an issue for somebody? Yes, we're looking at postural. Yes, we're looking at biomechanics. Yes, we're looking at a whole bunch of things which will help us determine if this is happening. And of course, the person's usually going to tell us, well, I have some numbness or pain in my shoulder when I lift or when I do that. So it's part of the investigative process. So that gives you an overview, thoracic outlet syndrome. I want you to think about that. And if you're having issues, any kind of issue like that, where you're getting some numbness or pain, etc., through the neck, and again, it can be on either side, it could be on both sides, in the shoulder, down the arm, etc., when you raise your arm, etc., this could be impingement of the supraspinatus tendon, a little different, also can be coupled with bicep tendinitis. So that's a whole other thing that can be happening with the shoulder, rotator cuff issues. But it's about reestablishing posture, correct posture, and good muscle length tension relationships so that you can maintain a really healthy posture. So there you go. Again, this is E Fresilli with Holistic Health and Fitness, and I wish for all of you a vibrant life. Take care.